Hi everyone. Today I'm going to tell you about my brief experience, the machine perfusion solutions. Machine perfusion is the most happening thing in the preservation of organ transplants. Today I'm going to tell you about a technique called hypothermic oxygenated perfusion, which is otherwise called HOPE. And there is another technique called normothermic perfusion. First, we have to understand how does this technique work, in whom this technique works, what are the benefits of these techniques, and how we can view the organ transplantation scenario in the future. When the liver you remove from a brain dead donor, it goes as a ischemic type of injury, and when you reperfuse it, you have reperfusion injury. There is loss of oxygen in the liver cells. The HOPE technique primarily restores the oxygen, that is the energy stores, otherwise called ATP, into the liver cells. It makes it more robust, and it makes the liver cells resistant to future injuries, and the liver works much better than it was before. In future, there will be a time where none of the cadaveric organs will be implanted without a machine perfusion. The HOPE technique consists of mainly this oxygenator and a pressure solution, and it's a dynamic perfusion thing. Now we come to the second question, in whom this technique is indicated. Is it indicated in every patient? No. Whenever the organs are marginal, what you call, this is not a lot of fat in it, has a lot of acidosis, high sodium, and you tend to reject these organs. But various studies have proven, even a recent randomized control trial has proven, that this technique restores oxygen and the ATP in the liver, and it makes it viable. We have used this technique in 4 of our patients, and it has worked wonderfully well. All these patients getting discharged at the 7th day or the 8th day. Otherwise, we would expect these patients to have lot of enzymes, high enzymes in thousands. Primary risk of primary non-function is there. And why this technique is important? Because we have a huge demand and a very limited supply of cadaveric organs. For example, if 10 people are waiting, we are getting only 1 organ. So each single organ, if it can be made more viable and given to patients and can save life, it's worth it. In this way, I think this technique is a boon to our human mankind, where we can make these organs work. And I congratulate Duraent Life Sciences Bridge to Life to bringing this technique to India. And much more important, this is very economical technique which the Indians can afford without much additional cost to the liver transplant. When compared to waiting list mortality, getting a marginal organ and making it viable with HOPE machine gives us a lot of hope. And I would appeal to all the government agencies to establish regional perfusion centers all over the country, where we can use these organs with this HOPE machine. Thank you.